I think one of the most hopeful things is just that finally we are developing drugs of importance for patients with ovarian cancer, good drugs with reasonable side effect profiles that may meaningfully prolong survival a meaningful amount of time. We're not talking a couple months. So, and I think behind this first wave of PARP inhibitors, there's a whole pipeline in almost every pharmaceutical company, probably every pharmaceutical company, I should say, of different but similar agents that work just in a different way, but in kind of the same DNA response pathway, which may be very effective drugs when PARP inhibitors stop working, or drugs that work with a PARP inhibitor so that people get a better response, or work in different subtypes. So there's just quite a wave of very exciting new agents coming behind these very effective PARP inhibitors. So clinical trials and clinical trial participation will continue to be really critical. Even though we've had some successes here, we just still have so many questions to answer. We're not curing people yet. We want to cure people, and so there's still a lot of questions to be asked. Clinical trials are going to be critically important in answering those questions, and there's a lot of really exciting agents, immune agents, DNA agents, targeted chemotherapy, other pathway targeted drugs, which may have relevance in ovary cancer. And so it's I hope, a hopeful time for our patients to finally have some new options, potentially better options, and then things on the way that if they have access to trials, they'll be able to take part in, hopefully.